get a test to help to squeeze the disease and reduce the restrictions that your town or city or area community has endured. And that way, through tough tiering and mass community testing, we hope to let people see a little more of their family and friends over Christmas. Now, I know that many of us want and need Christmas with our families. We feel after this year we deserve it. But this is not the moment to let the virus rip for the sake of Christmas parties. 'Tis the season to be jolly, but it is also the season to be jolly careful, especially with elderly relatives. And working with the devolved administrations, we will set out shortly how we want to get the balance right for Christmas, and we'll be sending that out later this week. Christmas this year will be different, and we want to remain prudent through Christmas and beyond into the new year. But we will use the three tools that I've described to squeeze the virus in the weeks and months ahead: tiering, testing, and the rollout of vaccines, employing all three techniques together so as to drive down the infection rate. And I really am assured now that things will look and feel very different indeed after Easter. And that idea of an end goal or date is important, because at last, if the promise of the vaccines is fulfilled, we do have something to work for, a timescale, a goal around which we can all, businesses can begin tentatively to plan. But with luck and with hard work, we will be seeing improvements before then. For now, the problem is not a shortage of hope or a lack of optimism, not with the amazing news that we're getting from the laboratories in this country. The challenge now, as we face this difficult winter ahead, is to fight down any over-optimism, to master any tendency to premature celebration of success. That success will come all the faster if we work together to follow the guidance, maintain the basic disciplines as people have done so heroically over the last few months: hands, face, space, get a test if you have symptoms, because that is the way we will beat the virus together. I'm now going to hand over to Chris Whitty to say a little bit about where we are with the vaccine, and then to go to Andrew Pollard.
Thank you, Prime Minister. In fact, I was only going to say one thing, and that was an absolutely massive thank you to all of those up and down this country who are volunteering for studies into COVID, some in vaccines, some in drugs, some in testing, and many in just trying to understand the disease. Because as we've repeatedly said, it is only science that is going to get us out of this hole. And people across the UK are contributing enormously to this by volunteering their time, volunteering their expertise. Very large numbers of NHS workers, National Institute for Health research, NIHR workers, Medical Research Council workers, working with the academics and working with the companies. So it is only by this combination of science that we will defeat it. And I just wanted to thank people from all of us for this enormous thing they've done to help us and everybody get out of the COVID hole. But it will be a long haul. And the main news from today is the remarkably good scientific achievement of the Oxford AstraZeneca vaccine, and Professor Pollard is the person who really can best outline that. Andy.
Thank you very much, Chris. And it is, I think, a very exciting day for all of us. And we're hugely proud of our team in Oxford who's been leading this effort. But I think it's important to pay tribute to the 20,000 volunteers that there are in the trials around the world, and over 10,000 here in the UK who've come forward in this uncertain time, feeling an absolute duty to play a part to help us get back on our feet and perhaps beat the virus. And of course, there's a lot of uncertainty in joining a clinical trial. And I think for all of us, having reached this point today, where we have evidence that the vaccine works, we have a huge debt of gratitude to all of those people who have taken part. Secondly, I just wanted to mention all of the researchers, and Chris pointed out that we have this amazing infrastructure in this country through the NHS and through the National Institute for Health Research, which meant that with 3 weeks' notice, I was able to contact 19 trial sites around the UK, and research nurses and doctors could come out of the woodwork and come and work on the trial to allow us to move so swiftly this year. And I think that's a unique situation that we have in this country that made it possible to do that. Our results today show that in our primary analysis, that's the analysis we agreed with all of the regulators, that the vaccine had 70% efficacy, which is fantastic. That's high efficacy, like we get with flu vaccines, and has the potential to have a really important impact on the pandemic, because we also, in the trials, saw no one go into hospital with disease or develop severe disease if they had been vaccinated. We also had these intriguing results, which you'll have heard reported in the media today, where one arm of our study had much higher efficacy, about 90%. That needs further work to look at it, but it's very exciting that there might be a way of immunizing with the vaccine that gives even better protection. Clearly from today, we have to provide all of the data to the regulators so that they can scrutinize that very carefully and decide whether it's appropriate to move forward for licensure. And we look forward to working with them to provide everything that they need for that purpose in the days and weeks ahead. And if they do approve it, we potentially, with the dosing regime that could be used, we may have more doses available than we thought. We have a vaccine that can be used at fridge temperatures. It can be stored at fridge temperatures. And for us in Oxford, this was really important because we want to be able to make sure that this can be distributed, not just in a country like this where we can manage any form of distribution, but around the world, because the virus actually isn't just a problem here in the UK, it is for everywhere. And our partnership with AstraZeneca has been critical because they agreed with our vision for this of having a not-for-profit approach during the pandemic, so that no one was profiteering from making a vaccine in the pandemic period. And that does mean that part of what we can offer will be the equitable access around the world, which is absolutely the vision that there should be from a university. So I think it's been a great day today for us, and as Chris said, for science, that here we've in 11 months been able to pull together all of the data required, meet the requirements for regulators to be able to put that in front of them. And I hope that we'll be part of what could be the end of the problems that we're facing that you were just hearing about from the Prime Minister. I think in the meantime, we certainly need to make sure that we protect each other through this period of time and have access to the new treatments that are coming along. But with all of those together, I'm also optimistic for next year. Prime Minister.
Thank you. Thanks very much, Andrew. And let's go straight to questions from the public. We've got David from East London.
Thank you and good evening. Won't going back to a localised approach to restrictions again after the 2nd of December lead to variable increases in the rate of infections, with disadvantaged areas suffering the most?
Well, thank you very much, David. Obviously, we have variable increases and decreases going on right now, and one of the interesting things is that it's some of the areas that have been hardest hit, and some of the areas actually that have been the greatest deprivation, where you're starting to see some of the biggest declines in the virus. I think that's thanks to the work of communities in pulling together. I'm afraid that since the summer, a regional disparities have been pretty obvious. What we started to see at the beginning of October, was really across the country, as we saw in much of Europe, a pretty universal second wave. What we want to do now is to push that R down. We think we've got it down to about 1 or just in that area now, but use this tough tiering to keep pushing it down across the country, and that's the best thing for deprived communities everywhere. But I wonder whether Chris, you'd like to or Andrew would like to comment on that issue as well.
Prime Minister, I think you've actually summarised it completely. The key thing is we need to make sure that people are in the right tiers, and then people adhere to the guidance. And if we do that, then we can keep things down. Thanks
very much, Andrew. Anything to add?
No, nothing to add to that.
Thank you so much. Let's go to Debbie from Buxton, and I'm going to read Debbie's question. Will there be a plan